Hi everyone. So today it's a week since we've been really working through and on some respects battling this outbreak in Shepparton. We're moving through it reasonably well, but we're certainly not on top of it. So as people would be aware, there's still 76 active cases in Shepparton. There has been more people unfortunately test positive for COVID-19 overnight and into this morning. So for that reason, we're really urging members of the community, particularly those people who are symptomatic, no matter how mild those symptoms are of COVID-19, to come forward and get tested straight away. Particularly as well, we want people from the following exposure sites, particularly these school sites, the Greater Shepparton Secondary College campuses of Mooroopna and Wanganui, and also two primary schools, Boucher Street Primary School and Mooroopna Primary School, to come forward and get tested as well. As I said, the fact that we're still having more positive cases being detected is still of a concern for all of us, which means in some regards we're not quite on top of it. Those cases are linked, which is a positive thing in some respects, but the fact that we're still having many people testing positive is of concern. I think from that perspective, we are starting to move through from our hospital operations. At the minute we have 520 people of our staff that are furloughed. Our staff have put in a huge effort in the last week or so to keep those essential critical services open. We continue to receive good support from our health service colleagues right throughout Victoria, and also from the Department of Health, who have been really great in terms of any requests that we're making to them. They're actioning that quickly and responsively as well. From a vaccination point of view, of course, that's something that we really want people to concentrate on as well. There's really good access to vaccination right across our hubs here in Shepparton, but also right across the state as well. So if you haven't been vaccinated, we want you to get vaccinated as soon as possible. Then finally, as I said, going back to the testing side of things, access to testing in all of the sites at Shepparton and Mooroopna is really strong at the moment. The wait times are down to around about half an hour to an hour. People wouldn't be inconvenienced on that front in having to wait. Two of our testing sites are open till 8 o'clock tonight at the Shepparton Sports Precinct and also at the Mooroopna Recreation Reserve. So as I said before, if you've got symptoms, you need to get a test straight away, don't delay it. And also if you've been to an exposure site, we want people to come forward and be tested as well. Happy to take some questions.
We are starting to see this outbreak spread past Shepparton, outside of Shepparton. How concerning is that?
Well, it is a concern, and I guess it's just evidence of how easy transferred or transmissible the Delta variant is of coronavirus. So it comes back to all of those important simple things that we can do, like wearing a mask, keeping our distance from everybody, sanitising our hands, all of those simple things. But also, given how quickly and easily this virus is spread, we of course want people to get vaccinated if they haven't been vaccinated already.
Can you outline some of those cases in the surrounding areas? How many are in Maryborough now, the Echuca cluster? Tell me about that.
So I don't have the exact numbers in terms of those linkages, but it appears at this stage from the work that the contact tracing team are doing is that they are linked. Exactly how they're linked is still being investigated and needs to be better understood by the contact tracing team. And I know that they're working as hard and as fast as they can in terms of their interviews with those people related to the new cases to understand what's happened and where there might be any further risks.
You're urging people to get tested, no matter how mild the symptoms are. Has there been any evidence to suggest that there is any reluctance at all from people, wanting to get tested, and if so, why that might potentially be the case?
I'm not aware of why people, in terms of specific people's reasons as to why they're not getting tested. Access to testing is not the issue, so there's plenty of great access to testing right across Shepparton and Mooroopna and other parts of the state. The Department of Health's website's got some terrific information about where all the testing locations are. I don't think it's about the test itself. It's pretty quick and straightforward from that point of view. To some degree, I think there might be a bit of hesitancy or complacency, a bit of human nature. People may, put it off or delay, think that those symptoms are going to go away. But at the moment, the most mildest symptoms are of real concern, and there's certainly a lot of the people that we understand in terms of that are testing positive at the minute. They have mild symptoms, so they just have the scratchy throat. They might have lost their sense of smell or a mildly runny nose. They're the people that we're really urging to come forward and get tested straight away, and don't put it off. It's just not worth the risk to themselves, and it's not worth the risk to their loved ones, let alone the broader risk to the community.
Well, I guess what's the potential danger then in having some people delay getting tested if they do have symptoms?
So the danger is, of course, to themselves in terms of their own health and well-being. The danger then is, of course, passing it on to members of their households, their loved ones, family members. The broader danger in terms of putting it off is those people's movements. Although we're in lockdown, some people can get out and about the community, but the danger is that they then transfer it to other people, other friends, other people at the supermarket, other people at different events or whatever the case might be. But then from there it can spread, and we know that there's a number of people in our community that have chronic health conditions or even young people. So the danger on that front is that the virus is getting passed around to people who become really unwell with COVID, and that's certainly not what anyone wants.
You described that we're in the second quarter on ABC this morning. What will it take to get out of this, and how long do you predict to get out and into the third even quarter?
So really, in terms of progressing through, using that football analogy, to get to half time, we really want everyone who is symptomatic to be tested, and certainly all of those people from the exposure sites that haven't been tested to come forward and get tested straight away. I guess that would in some respects represent the half-time break, where it would give the contact tracing team and the public health experts the chance to have a look at where things are placed and reassess what the plan might look like for the next 1 or 2 weeks from there.
Do you know of any cases in the Indigenous community?
Not that I'm aware of, no. I don't know if there is any particular people of First Nations background who may be positive.
Can I ask, yesterday you said there was no one in the hospital here with COVID. How are we going today? Is there anyone in GV Health with it? Anyone from GV Health taking it elsewhere?
So I believe there is some people in the community. Again, it goes back to what I mentioned a few minutes ago. There's some people who are unwell with COVID who have been able to stay at home up until now. But the reports I've had just in the last 1 or 2 hours is that some of those people, their health is deteriorating, and they're most likely going to need a higher level of care. We've got a fairly skilled group of clinicians that are monitoring people who are at home with COVID. We've got our chronic disease teams and also some of our physicians overseeing their care. So they are being monitored, they're being checked in with every day, at least as a minimum. But as I said before, that someone who may have a chronic condition, or indeed someone who's well, doesn't take much for this virus to make them unwell very quickly, and they can deteriorate quite quickly from a health point of view as well.
Do you think enough was done at the start of this outbreak here in Shepparton to try and contain it, or do you think the response should have been quicker when the cases were first recognised in Shepparton?
I think the public health response was appropriate. We've taken really strong steps to lock down particular school groups and communities as well, and as difficult as that is for all of those people, it's the right thing to do from a public health point of view in terms of preventing the spread of COVID more widely. What we do know is that by now, I think it'll be over 21,000 people in Shepparton and Mooroopna have had a COVID test through the sites that GV Health is overseeing, and that's over 40% of the population. So if you look at it from that perspective, it's a really good effort. But again, as I said before, I think we've moved as quickly as we can. To mount a response like that to test over 40% of our population in a week is significant in terms of standing up the services and related infrastructure in that regard. But again, it really relies on people coming forward when they've got symptoms to get tested straight away and don't delay it, That's the most easiest and simple things that people can do to help their households and the community.
The testing numbers in the last couple of days, we've noticed driving around that there seems to be less people at the sites getting tested now. Do you have anything on how many numbers they've had? I know earlier on you were talking about 3,500 a day being tested. Obviously those numbers are not quite as high now.
So they're in the mid 2000s yesterday, so in the order of about 2,500 tests. Prior to that we were hitting around 3,000 a day, and the couple of days before that around about 3,500 per day. But that's pretty typical in terms of what you would expect to see in relation to the nature of this outbreak. But again, you know, if you've got symptoms, there's no reason why access to a test is a barrier. Come forward and get tested.
Good afternoon and thank you. Our focus in the relief space has very much been focusing on the needs of community and making sure that we're meeting those needs as efficiently and as effectively as we can. We've got a number of operations working together. A lot of these are ones that have already been established and have been operating within the community, as I've said, for quite considerable time. We have worked to bolster that and make sure that we get surge and uplift where it is we need so that it can effectively meet that growing demand that we have. I'll talk a little bit about the operations that are joint with Red Cross and with Goulburn Valley Care, GV Care, and also with local transport groups aiding and volunteers assisting, ADF as well joining in on these teams, making sure that we've got food packages going out to people who are requiring food in immediate relief. This work has already been going on as from yesterday, and today there is again a massive uplift in this program of work. Over 400 packages will be going out today to members of community that most need that. This isn't as I said, the only operation that is working to make sure that relief needs are met. Multiple volunteer agencies working hand in glove, and what I can say is we are seeing enormous cooperation and collaboration right across the sector, right across agencies, to making sure that those in most need are getting food packages as quickly and as efficiently as possible. In addition to this, we also know that our food and grocery sector is also rallying to the cause and making sure that they're doing everything they can to increase things like online service delivery, making sure they're drawing from outside workforces that can work within the Shepparton footprint, and again bolstering that ability to deliver food and relief to those and keep the stores open for those in the greater Shepparton community. In addition to all this, again there's broad cooperation and general reassurance, making sure that our community feels that it is being supported, and this is so important. And most of that is actually coming from within. So families, friends, relatives are supporting their neighbours, their colleagues, those that can't move about the community freely, dropping off food, making sure that needs such as pharmacy needs are met. All that is happening in conjunction with the broader programs of relief services that are coming out of agencies such as Red Cross and GV Care, and supported by the ADF. Again, I can only say if people are finding they're not getting what it is they need, could I please direct people to the public health 1-800 number. This is 1-800 675 398. This number allows people to move to an option for relief. If you are experiencing any key difficulties, please phone that number and make sure that you get your message through as to what it is you need. Could I also finish off with, on the Greater Shepparton Council webpage, there is a lot of information as to how it is you can receive services, and be that food and grocery or what other essential needs that you might need. Finally, can I just say thank you to the community of Shepparton. Where we are seeing so much goodwill and rallying support. This only comes from a really connected and community that would just thrive in and support each other within emergencies. Emergencies bring out the best in people, and that's exactly what it is we're seeing in Shepparton. Thank you again.
Deb, some people have said that if this was a fire or a flood and you had thousands of people impacted as they are here in Shepparton, because obviously people are having to isolate, which means they don't have access to basics, that the response probably would have been different, or it would have been quicker or sooner. Do you think that EMV and ADF and others could have gotten on board sooner than what they did?
I think sometimes there's a misconception that all these services aren't working as they do work normally within an emergency. It's not necessarily as visible, and sometimes, yes, we need to surge in particular areas, but we have to remember this is a statewide emergency as well, and that does mean that that sometimes as we're dealing with other parts and focusing in on meeting needs on a broad statewide level, that it does have the appearance that we're not focusing in on the needs of Shepparton. That definitely wasn't the case. Did we need to do more, and have we done more? Yes, we have. And again, it's not different to what we find within communities that are isolated by fire and flood. Often it takes a little bit of time to actually understand what are those exact needs that people require, and be it communications, food relief, access to roads. Within an emergency, no emergency is the same, and understanding what it is and where we need to focus our efforts sometimes does take a little bit of time. I can only say to the community, there was always work going on, and I hope that there's a level of comfort in knowing that we've been with you from the beginning, and we're still here, and we will be with you throughout it all.
So I'd just like to pick up on what Deb was saying and just thank and acknowledge there's many different community groups and service organisations and individuals that aren't in quarantine that are dropping food off to people's houses. There's an unbelievable network of people that are just contributing to helping those people, particularly some vulnerable members of our community, receive the bare essentials that they need in their house to keep their household running, such as food and nappies and formula for feeding babies and toddlers. So the relief effort is really important in terms of the community and the support that the community needs. Tonight at 6 o'clock there will be another community forum which is openly accessible to anyone. Details about that community forum is on the GV Health Facebook page. It's able to be streamed live through our Facebook page, so anyone using whatever device they may have will be able to access that. We'll be providing a short overview and update about what's happening with the outbreak, but really the focus is going to be having the opportunity for people like Deb and Council and other areas of the government talk about the relief and support that is available and what things may look like in the next few days. So 6 o'clock tonight, that community forum, it's open access, and we encourage anyone to attend. Thanks.